Patient Zero, the grand experiment. There was only one way to find out, by asking. So that summer, on his own, in the evenings and on the weekends, John Snow went from house to house in South London, knocking on doors, inquiring how many people in each home had gotten sick and how many had died. Then he would follow up with an unexpected question. Did you know which company supplied your water? In the neighborhood south of the river, most people are no longer got their water from the public pumps, but had it pumped in from the River Thames. There, where two private water companies supplied that part of London, the Lambeth and the South Water and Vexenhall. While Lambeth piped in water from a relatively clean part of the river upstream, Southwark and Vauxhall drew the water downstream from the main sewer lines, which poured the city's waste into the water. Would that difference affect who got sick? John suspected it would. Significantly, there was no predictable pattern to the water supply system. One house might be supplied by Lambeth, while all its nearest neighbors got their water from Southwark and Vauxhall. If John could show that cholera struck only the homes supplied with dirty water, it would be strong proof that miasma was not the cause. He hoped that this grand experiment would establish once and for all that cholera was spread through contaminated water. Before John could complete his investigation, the Broad Street outbreak began. Could he apply this technique he had been using in South London, find the source of the outbreak, and do it fast enough to halt the epidemic or to stop it from spreading beyond Soho? He knew he had to try. The search for Broadens. John marched up and down the streets of Soho, taking samples from all the local pumps. He hoped he'd be able to identify which contaminant. But when he got the vials of water home, they all seemed to be clear. John wasn't easily discouraged. He took to the streets again, knocking on doors, asking the same odd question. Has anyone in your house had cholera? Where do you get your water? Over and over, he heard the same answer. Broad Street pump. There were a few places that had escaped the epidemic, but even these exceptions seemed to point back to the pump. Just around the corner from Broad Street at 50 Poland Street, there had been only 2 deaths reported at the St. James Workhouse, a charity home for more than 500 Sohan's poorest men, women, and children. When had the cholera hardly touched these residents while killing so many of their neighbors? The answer was that the workhouse had its own well right on premises. The other locations in the neighborhood that seemed to have been passed over by the epidemic was a brewery in Broad Street. When John Snow asked the brewery owner where his workers got their water, he learned they were given a ration of beer every day and drank that instead. By now, John was convinced that the Broad Street pump was the source of the outbreak, but there was only one death he couldn't account for. Susanna Ellie, an elderly woman living across town in the Hampstead Heights neighborhood, had died of cholera on September 2nd. The data put her right in the midst of the Broad Street outbreak. Yet, what could her connection to the Soho epidemic be? With a few more questions up and down Broad Street, John got his answer. Susanna's Sons operates the Ellie Porkus Cap factory on Broad Street. Every day they sent their mother a jug of cold water, fresh from the Broad Street pump, because she insisted that Broad Street had the best tasting water in all of London. Sue Ann Ellie's love for the water from the Broad Street pump had been fatal. Can you handle the truth? By Thursday, September 7th, more than 500 people had died in an area of only a few blocks. An emergency meeting of the parish council was called. Worried men in tall hats and dark suits gathered in the parish hall to see what could be done to halt the deaths and sufferings. Just as they were agreeing that burning sulfur in the streets to disinfect the air was the best strategy, a stranger sitting alone in the back of the hall asked permission to speak. The council members listened in astonishment to Dr. John Snow laid out the results of his door-to-door research. The council was skeptical about John's outlandish water theory. However, they reasoned that preventing people from drinking the Broad Street water could do no harm. It just might do some good. The next day, workers were sent out with instructions to remove the handle of the Broad Street pump. The spread of cholera, which had already been declining in the neighborhood, stopped altogether. The epidemic was over. But the Soho Parish Council and the London Board of Health were not convinced that contaminated water had caused that outbreak or that the well was a source of contamination. They asked John Snow to continue his investigation and report back to them. One man from the council volunteered to assist John with his investigation, but he wasn't an ally, at least not at first. Henry Whitehead was the new assistant minister at St. Luke's, the local church, and he was convinced that John's theory was just plain wrong. The picture comes into focus. Despite their differences, the shy doctor and the young minister made a good team. Henry Whitehead was just 29 years old, and St. Luke's was his first parish. He was full of energy, and he already knew many of the residents of Soho by name. Day after day, he paced the streets, knocking on doors, trying to track down residents who had fled the neighborhood in the early days of the outbreak. He visited some homes 4 or 5 times until he was satisfied that he'd gather all the information he could. While Henry walked the streets, John spent hours every night in his study, poring over the data they'd collected. Frustratingly, there seemed little left to learn. Then, one night, John tried something new. He took his list of confirmed cases of cholera and transferred the information onto a map in the neighborhood. He drew a black bar for every case reported from each address. Soon, there were clusters of black bars up and down the winding streets. He studied the map. Something was missing. John picked up his pen and marked in the locations of all the water pumps in the neighborhood. By the time he put his pen down, he saw that he had drawn a picture of the epidemic. The black bar radiated out of the Broad Street pump, thickest near the pump and getting less frequent further away. He felt certain the map would make an impression on the council in a way his earlier lists and tables hadn't been able to. But he still faced a problem. Could this map convince Henry Whitehead? Turn to page 41. The Great Debate. Masame versus germs. Today, it seems odd that so many people, including most doctors, believe diseases floated around us in an invisible cloud called mazama. How did the idea get started, and why did people believe it for so long? The term mazama comes from the ancient Greek word for pollution. Mazama was thought to be a poisonous mist or vapor rising up from rotting garbage or organic matter. Even the word malaria, for instance, comes from the Italian mal'aria, literally bad air. By the 19th century, nearly everyone equated bad smells with diseases. Even after scientists like John Snow and later Robert Koch, who in the 1800s were the first to identify the bacteria that caused cholera, proved that germs, not mazama, were the sources of disease. Many people refused to change their opinions. Florence Nightingale, the founder of modern nursing, believed until the day she died in 1910 that mazama was the source of many diseases, and she championed cleanliness, hygiene, fresh air, and sunshine as ways to prevent and cure diseases. Nightingale's emphasis on the importance of high standard of hygiene in hospitals has saved millions of lives, and she was right that there is a connection between poor sanitation and diseases such as cholera and typhoid. But the connection is germs, not smells. Turn over to page 47. Tools of the trade, mapping outbreaks. John Snow's map of the Soho cholera outbreak is still studied by students of epidemiology. John was the first to use maps to show how disease outbreaks are linked to risk factors in the environment. In the Soho epidemic, when the city officials saw how the cases clustered around the location of the pump, they realized that closing the pump could stop the outbreak. Today, epidemiologists map outbreaks using sophisticated software that allows them to track and predict the spread of epidemics through both space and time. Mapping disease outbreaks is more complicated now than it was for John Snow because of the way that travel has changed. In the 1800s, travel was slow. Maps of diseases outbreaks tend to show ripples radiating out from a single point, like the waves spreading from a stone dropped in a pond. Air travel changed that pattern completely. Now maps of disease outbreaks show clusters appearing randomly across the globe. Shanghai, Brussels, Vancouver, Mexico City, and they look more like bursts of fireworks than ripples in a pond. But researchers have realized there is a pattern to what looks like chaos. International travel today happens through a linked network of airports. Substitute the typical map of the world with a map that shows the flights between different cities, and the randomness of the outbreak becomes more predictable, resolving into the same outbreak ripples that John Snow's original map. Turn to page 49. Do you smell what I smell? In 1854, London was the biggest city to date in the history of humankind, with a population of 2.5 million people and growing. But it didn't have citywide sewer systems, a city dump, or even one city garbage collector. The results? London was drowning in its own filth. Many houses weren't connected to a sewer and relied instead on cesspools, large underground pits, where each household deposited its waste. When the pit filled up, the landlord called in the night soil men, who came and emptied it, hauled the contents away to the edge of town. This system had worked well for a long time, but London was growing fast, and the edge of town was getting further and further away. The night soil men raised their price, and soon landlords were putting off having their cesspools emptied. The cesspools frequently overflowed, flooding cellars with human waste. The situation wasn't much better for those who lived in houses connected to sewers and running water. The sewers emptied straight into the Thames, the river that flowed through the heart of London. And where did that city's drinking water supply come from? Why? From the Thames. Using the river as both a sewer and a water source created a perfect environment for spreading diseases. All that sewage also made the city incredibly smelly. And human waste wasn't the only problem. London was full of industry, breweries and tanners, forges and factories, and full of animals. Horses, chickens, pigs, and cows were kept in small enclosures. They all added to the waste and garbage and smells. So not too surprising that people connected the epidemic that regularly raged across the city with London's most immediately identifiable problem. It stinks.